Hello, class. This is Dr. Collins. Welcome to my short lecture on wound healing. This is the continuation of what we've been learning in inflammation. So let's get started. Okay, Chapter 2, Wound Healing. So wound healing is the dynamic process by which the skin and other body tissues repairs itself after trauma. So the topics that we're going to cover are the types of healing, so normal, delayed, non-healing, specific sequence of events and the specific cells that are involved, primary versus second intention healing, and complications that can occur. So there are several factors that determine how well an area will heal. One is the site of the wound, in other words, where it's located. Is it in the skin or the brain? So skin heals generally very quickly and generally very well. The brain, on the other hand, as we already know, does not tend to heal, and so we get those fluid-filled cysts. The size of the wound is important. Small ones will heal better and faster than large ones. Mechanical factors are certainly an issue. Tension, that is the amount of pulling forces put on the wound, are going to be a factor. If the wound is in an area that gets a lot of movement, like let's say on your shoulder, and then certainly if there's the presence of any foreign particles that have gotten embedded in the wound, all those things are going to delay the healing process. Infection, again, very important factor. Is the wound sterile? Let's say what would happen in an operating room, or has it been infected? If you get a scrape on the side of the road, you know that you're going to get a lot of particles, debris, and bacteria in that particular area. Circulatory status is important. So is the tissue getting enough blood? If it's not, it's going to be what we call ischemic. You need blood in order to get all the new cells in the area and the nutrients that are needed and the substances that are needed. So if you have a problem with circulation, you're going to have a problem with healing. Also of a consideration are nutritional and metabolic factors. So if somebody has malnutrition or a vitamin C deficiency or a chronic disease such as diabetes, then you're going to have more problems with healing. And finally, age. Children are always going to heal better than the elderly. So there are a number of cells that participate in the process. The first two are cells you're already familiar with. We have neutrophils. These are the cells that are able to come in initially, right away. They will kill any pathogens and then start cleaning up the injury site. We also have macrophages present. So we have them present as being a sentinel cell, certainly. So they're ready to start the process of inflammation and then healing. Remember, they are masterminds. They actually will direct the healing process, and they do that by secreting various cytokines, chemokines, and mediators that will stimulate multiple cells to arrive to the site and participate in the healing process. So some of those cells are fibroblasts. These are the cells that will produce most of the extracellular matrix that is needed as a scaffolding for the new tissue that forms. And they are cells that have a variety of secretions that help create that matrix and are very much known for the collagens that they produce. We also have myofibroblasts. So these are cells that you can think of as a combination of a muscle cell and the fibroblast that we just talked about. So they are involved in contracting the wound, that is the bringing the sides of the wound together. And in that process, they reduce the size of the defect. They also secrete matrix substances. Again, these are needed to create the scaffolding for that wound repair. And finally, we have the angioblasts. So with new tissue, we need a lot of new blood supply. And these are the cells that will create the new vessels, primarily the capillaries initially. So the tissue that's formed is actually called granulation tissue, and it is a very immature form. It is very rich in that extracellular matrix and the collagens and such. and there's a lot of newly forming blood vessels that are present, and a lot of these cells that are needed for the healing process. This tissue tends to be bright red. It bleeds easily if disturbed, and this is due because of all of the new blood vessels that are forming and because of the presence of inflammation. It is a dynamic tissue. There's a lot of changes that are going on inside of it, and this is because of something called remodeling that occurs. And the final goal of the healing is to develop into a scar, basically, create scar formation. Now, the process, the maturation process, can actually be delayed sometimes and also possibly never completed. So, if this happens in, let's say, the mouth, you've done an extraction, for some reason you have a lot of granulation tissue, patient comes back a week later, it's still there. What you do is you go back in and you clean it out because probably there's something in there, maybe a little bacteria has started an infection, or there's a bit of bone or tooth that's still in there that's irritating the tissue and preventing it from completing the healing process. So you go back in, you clean it out, you make sure you get good bleeding, and you start from fresh. And not only dentists do that in the mouth, but also surgeons will do that if a site is not healing properly. You clean out the old and you start with new again. This is a chart of your granulation tissue, just shows you what's going on inside. Here you have your existing capillaries and new ones budding off of them. You have a lot of these myofibroblasts present, again creating the matrix and also pulling the wound together, and then certainly your macrophages. And notice you have a lot of these macrophages and probably neutrophils present here. This changes as the tissue starts to mature. So here we have granulation tissue that's a little further along, fewer blood vessels, the vessels themselves that are present aren't budding anymore. We have many fibroblasts present and many fewer of the white blood cells. And also the collagen is changing. The collagen here is actually going to be a stronger type than what was created initially. Here's a picture of granulation tissue. So this is something that I'm sure all of you have seen before, especially if you have a scab that comes off too soon. Usually there's a little bit of healing. Sometimes there can be a lot of, bleeding. Sometimes there can be a lot of bleeding depending on which stage that granulation tissue is actually in. But you can see how it's bright red and you can just looks inflamed. So in terms of the healing process itself, we have two main methods. We'll start with a primary healing via primary intention. This occurs mainly with small, clean-cut injuries. So think of surgical incisions or even a paper cut on your finger. Here, the wound margins are actually able to come together and they are touching each other and can hold each other so that it doesn't move apart. You get little or no granulation tissue in this case, and the healing will occur from the sides. So remember that, healing from the sides with primary intention. So this actually will accelerate healing and you end up with little or no scarring. Again, a little diagram. So primary intention, here you have an incision. This one's a little larger than a paper cut. In fact, here you see some sutures that have been added to hold the sides together, and actually a scab is formed. However, it is a clean cut issue or situation, so healing will be fairly simple here. You do see a lot of the white blood cells present. Here, moving on, you see the granulation tissue, you see blood vessels, and these myofibroblasts and regular fibroblasts. And then you end up finally with a minimal scar created, and then the epithelial layer has completely closed with probably no visible scars or very slight scarring on the surface. Now we move on to secondary intentions. So in this situation, we're dealing with larger wounds and all infected wounds. So because of the size and other issues, the margins are not able to come together and touch. They can't, what we say, approximate. So think about the ulcer that we saw in the inflammation lecture. It's kind of a big open kind of wound. So you need a lot of granulation tissue to be created to fill in this defect. And in this situation, you're going to have healing primarily from the bottom up. So remember that, healing from the bottom up with secondary intention. So in this case, it's going to take longer to heal, and there will be more scarring that will result. And then in this diagram, if you start at the top here, you can see 3 examples that would create this situation. One is basically the gaping wound. Let's say again that you scraped your knee and you have a lot of epithelium gone and you've got a bleed going on. Well, that scrape can get very infected and can be very dirty. You can have a lot of grit and sand and dirt inside of it. And you can also get the bacteria occurring. Probably you will. So then you're going to have more to deal with to get this wound cleaned up and get it to heal properly. So you can see the sides are not able to come together in this situation. Here you have a lot of granulation tissue that has to form, and it starts moving up as it fills in this defect. Again, you see all the cells of healing present, and then a lot of the blood vessels. And then moving on, finally, you end up with a larger scar. And usually you'll end up being able to visibly see on the surface a scar that you can see. So here's a slide that just sort of shows you in, let's say, real time, I should say, or real life. You see the initial wound. You can still see some of the blood clot, the scab that's present. The wound starts to heal. Something called re-epithelialization occurs. So the epithelial cells start to actually migrate into the wound area as the wound fills in. And you can see there's less granulation tissue here than in the first image. The tissue is starting to mature, or we call remodel. As you go along in time, we get less and less of the granulation tissue, more of the remodeling occurring, more of the epithelial cells moving in. And here you're seeing more and more. The healing process is almost complete here. Still a little bit needs to be happening. And finally, you get to the completed wound healing that has occurred. So in summary, we have 4 basic stages that you just witnessed. First, you have hemostasis, so that would be to control and stop any bleeding that occurs at the site. Then you go into inflammation, primarily to combat that infection that occurs usually. Proliferation, where you have that granulation tissue that's being created. And then finally, remodeling and re-epithelialization, and this will result in the closure of the wound and scar formation. And this is the little video, the short video that I have asked you to watch. I can't show any videos on my recordings, they just don't go through. So go back to modules and you can pick it up there. So of course we can have complications, and they fall into primarily 2 main categories. One where you have deficient healing or deficient scar formation. The other is excessive scar formation. So with the deficient situation, we get something called dehiscence, and this is where the sides of the wounds doesn't properly close. So the margins can separate under tension, under the pulling pressures, and this can create, as I say, the gaping, and this is because you have insufficient development of the wound, of the strength that the wound needs to resist those pulling pressures or tensile strength. Then you can have excess scar formation. Notable here is what we call keloid scarring. This is where you have hypertrophic scars created. So these are scars with excess tissue that actually rises above the epithelial surface. They're often discolored and disfiguring. And contractures can be a complication of keloids, certainly, or any excess scar tissue that is formed. So this is where you have an exaggerated contraction of the tissue around the scar. This is primarily a result from burns, and it can be so severe that it can impede the actual movement of the tissue in the area, or even a limb that may be involved with this. Here's a slide of dehiscence, so you can see the surgical incision. It looks like there were some, actually, I think these may even be sutures that are still in place. Here, if it was sutured, they are now missing and gone. So this area was not given enough time to heal. The tissue, new tissue that's here, isn't strong enough to resist the pulling forces, and it has gaped open. So dehiscence. Then we get to the keloid scar. So you can see how in this situation, the scar is actually, it almost looks like a worm in the tissue. It's actually raised above the rest of the skin here and discolored. So if this were to occur in the face, it would definitely be very disfiguring. And then finally, we have a combination here of keloid scarring in addition to contracture occurring. So you can see this massive scar. You can see how in the neck here, the tissue is being pulled into it. And certainly here at the corner of the mouth, the same situation, being pulled into where this scar has formed. So for this individual, I would imagine that he would have trouble turning his neck, and also perhaps even speaking, just because the lip can no longer move properly and form the words properly. And that is the completion of this mini lecture. So just realize that anything that is on a video like this is information that I will be testing you on, and you need to know. And I do have the PowerPoints for this also, where you can find them in the modules. So I will see you soon for our next lecture, and have a good day.